Jeff, it's really a pleasure to get to know you. I want to tell you a little bit about what I do with respect to the industry. Then I want to give a little introduction to Jeff. Then we want to get into the myths and the realities of cannabis, particularly with respect to medicine. First of all, with respect to cannabis, I've joined with a number of medical people to form a company called Cana Enterprises. And what we are is an aggregator of proprietary rights, mainly patents, relating to the remedies and delivery systems in 4 industries: skincare, dental, agricultural, and veterinary. And so we've done a lot of looking into the medicinal aspects of it. And I've certainly learned a lot having talked to you, Jeff. Jeff, I want to give a little bit of your background, and I know that I have it by email this morning as I was coming in from another family conference in Miami. And hopefully it pops up right here. Okay. But I know that your main company is Intiva, which is involved in the extraction of medicinal products. But I know that you have a rich background going back to being a pioneer in China and doing a lot of business in China. So you're really a market pioneer, and you wrote a book about China as being the fastest economy and why it was the fastest economy. And now you've taken the bold step of writing a book about marijuana, the world's most misunderstood plant. And you've been involved in a number of public companies and private companies. You counsel people on investment as well as product development. So it's a real pleasure to meet you today. Now you talk about marijuana being the most misunderstood plant. And why don't we just start there a little bit and give us a little bit of your reasoning and what are the myths and realities of marijuana, then we can dig in a little further, please.
Okay, let me just, I guess, jump into a bit of an introduction as to how I sort of came from being involved in China and being an early participant in China to being in the marijuana industry, because I think it leads into this, Kevin. I was first in China in 1987, and a couple of you in the room remember me from those days and being sort of New York centric at that time, even though I always lived in Colorado. And so I had an office in Beijing for 10 years. I was used to working and being involved in an emerging market, which China was. There was, no legal system, an embryonic legal system. There was really all the issues for investors of dealing in emerging markets. That pretty much came to a halt in 2008 for reasons everybody that's here knows about. So I really did not have a lot to do after 2008. We closed the office in Beijing. I had done work in Indonesia and Sri Lanka and in Brazil. That came to somewhat of a roaring halt. And I was speaking with Richard Greenberg, who's here. He'll speak a little later today on Intiva at the afternoon session. And we both live in Colorado. Richard's an attorney. And we said, why don't we investigate this new industry that's going to be in Colorado called, legalized recreational marijuana. So during the summer of 2013, we started investigating the industry. And we did lots of meetings, Starbucks meetings, some with semi-functional human beings, some with participants that had been on the medical side in Colorado that had a long history, others with a lot of wannabes that wanted to be involved in the industry. And that led Richard and I to provide funding. And you just heard the session on legal and all the issues in Colorado. We went through that and became approved by Medical Enforcement Division, the MED that was just referenced in the previous session, as owners eventually in Colorado. It took Richard and I 4 months to get approved. I was fingerprinted 4 times, he was fingerprinted 6 times by different jurisdictions, FBI background checks, etc. But we started doing a lot of meetings. And every meeting we went to, because this plant has basically in the United States been illegal since 1937. Nobody really knew anything about it. There hadn't really been anything done on the research side. There was no history. It was ignored. It was black market. It was illegal. And I'd attend meetings, whether it's with people from Kansas or Texas, and the terminology was really unknown. The history was unknown, and nobody really understood anything about it. So it's sort of all these meetings led to the fact, let's put together sort of the equivalent of an introduction to this plant, a misunderstood plant, so that, ideally it can help me in meetings. I don't have to spend an hour going through terminology and wordings and what's going on with it. So I think it's a basic primer to the industry. And it covers everything from the history, historical use. And when Noah asked me to do this today at this event, everything this morning was sort of focused a lot on the recreational side, and that's going to be a big market. But I really focused the book a lot on the medical side, not necessarily because of where medical is today in the cannabis space, but I think ultimately that becomes a bigger industry. I think recreational is, and we can talk about this, Kevin, but recreational will be huge, but big dollars ultimately are on the medical side. It's my opinion. I think it's Richard Greenberg's opinion, one we came to over the last 14 months. So that's how I got into this.
Before we jump right into medical, let's just talk about, I was really surprised. You're a man of such experiences, and you have a lot of experience in the cannabis industry, and you really have decided to leave certain aspects of it and really grow into other aspects of it. And I think it'd be worthwhile for the audience to hear, let's talk about extraction, yes, but in the retail and cultivation, you have some other opinions. Could you tell us about that, please?
Yeah, the Colorado experience, and I use those words together, I think are key. Because Colorado was the first state to have legalized recreational marijuana. The store that in Breckenridge, Colorado, a ski town, that Richard Greenberg and I provided the capital for them to convert their license from medical to recreational on January 1 of 2014, made national news. It was a snowstorm. The store was on the second floor of a Victorian on Main Street, Breckenridge. For any of you that have been out there, people were waiting in line to be able to buy legally for the first time recreational marijuana. It was an older population group, people from Iowa, people from Texas. Some of them said to us, I can't believe I'm walking in off the street and being able to buy recreational marijuana. I'd get 7 to 10 years in Iowa for this. So a lot of it had to do initially with the fact that it was sort of forbidden fruit, and it was something they could do that they couldn't do in their home jurisdiction. That was a very big deal. And just to put a little bit of perspective on Colorado, I believe a lot in the Colorado model from a regulatory perspective. I think we have a better regulatory model than Washington State or Oregon, other recreational states that have come on board, or Alaska. I think it'll be emulated, new improved version in other jurisdictions. The problem is in Colorado, and Richard and I elected to get out. We're in the process of trying to get out from the licenses that we own. We're owners in 2 retail locations, Breckenridge still and Crested Butte, Colorado, another ski town, with a grow facility south of Steamboat Springs, another ski town. So they're mountain communities. Is that there are a lot of participants in Colorado. There are over 20, I looked it up this morning, 2,100 licensed marijuana businesses in Colorado, between retails on the recreational side, retail stores, cultivation facilities for the retail sales, people that turn out the infused products, the edible products, extracts, etc. And on the medical side, a separate set of regulations. Those are dispensaries, medical infused product manufacturers, again, extracts, edibles, etc., as well as growers. So one of the problems has to do with, my background is obviously corporate finance and investment banking, has to do with supply, demand, and pricing. So Colorado is a relatively small state. It's not New York State. It's not New Jersey. And we have 2,300 businesses trying to compete. In Colorado, there's a lot of product. You can buy, on some days you can see a special where you can buy an ounce of pretty good marijuana for $125 or $150. So it becomes a bit of a commodity. And our conclusion was that we're not sure who is really making money. And ultimately, I was interviewed by USA Today in February, and they said, do you think the cigarette industry is involved in recreational marijuana in the United States? And I said, well, I'm sure they're looking at it, but with the scrutiny that the cigarette industry has had from both the state and the feds, over cancer for the last 30 years. They're not going to touch it till it's legal at the federal level. But the bottom line is they're logical participants to be in the industry once it is legal, because they know how to make things called cigarettes. So we think it's supply, demand, and pricing. Now, I'll get back, Kevin, I'll let you ask the next question here, but if you look at like Maryland, which I think is going to have 20 licenses, or New York State, where New York State can say we have access to medical marijuana, but in reality, there's no patient access here because it's only provided through, a very small number of hospitals, and a regulatory regime is to, the real question is, can your aunt who has arthritis or is going through chemotherapy, what is her ability to access medical marijuana in this state? That's a big question. So it's not about 24 states, 26 states that have access to medical marijuana. What is the patient access? And a lot of those states is very limited. So we elected that we wanted to be out of this, what we see as a bloodbath in Colorado, supply, demand, and pricing. And that, we formed Ativa about in February of 2014. We did some other things, and we want to focus on what we're doing on the Ativa side, which is tied a lot to the future of the extraction, use of extraction, but we wanted to be out of the bloodbath that we see coming, supply, demand, and pricing.
Let's go to medical, and then let's go back to standards, because I want to make sure we cover our topic and cover it as thoroughly as we can. What I've learned about CBD versus THC, I think it's actually fascinating. And one of the things that I learned, and partially from you and partially from others, is the difference between the phytocannabinoid system and the endocannabinoid system. And I think it's actually a really very interesting area of knowing the human nature of the endocannabinoid system. Could you tell us about the phytocannabinoid versus the endocannabinoid as we delve into the medical side?
Okay, I'm not a scientist, and I probably should defer to Dr. Sagi in the third row. We'll talk this afternoon more about it. But the bottom line is really this, is that the science has established that the psychoactive effect and a lot of the pain-killing effect is from the cannabinoid THC. And THC was discovered by an Israeli scientist 40 years ago named Meshulam, Dr. Meshulam, Raphael Meshulam. And I think Odette will talk about this a little bit later this afternoon. And so we basically know that's what gives people the high, and that's how it also provides a lot of the medical benefits on the pain side. Now, I have to say basically that there's been virtually no research in the United States, because it has essentially been illegal since 1937 to do medical research in the United States. And that probably about 95% of medical research on cannabis has been done in Israel. And a lot of that was funded by the NIH, National Institute of Health, here to Israel, because they couldn't fund it in the United States. So without going into all of that, but what happened was the endocannabinoid system was actually discovered by scientists from St. Louis University. And they were receptors that ultimately were a CB1 and CB2 receptor throughout the body. The CB1 receptors are primarily, I use the word primarily, there's a lot of issues here, in the central nervous system and brain. CB2 receptors are throughout the body. CB1 is what really benefits on pain, or the psychoactive effect on the recreational side. And the CB2 receptors seem to work as really for an anti-inflammatory, and immune system responses. And again, research is at an early stage. And the bottom line of it is that Dr. Meshulam in Israel concluded that these endocannabinoids throughout the human body had to exist because there were natural substances within the human body that reacted with them. So those are endocannabinoids in the body. Phytocannabinoids, from the Greek, phyto meaning plant, are from marijuana, and those really relate to the psychoactive THC and the non-psychoactive CBD. And so these cannabinoids, and there's actually 111 cannabinoids unique to the marijuana plant. Cannabinoids are chemical compounds. They're unique to the plant. There's probably more to be discovered. Other than the big 5 or 6, we know very little about the rest of them. We don't know much about the interaction of those cannabinoids at the cellular level. So marijuana works. Bottom line, marijuana works. Whether it's on the recreational side as a psychoactive, whether it's on the medical side for all kinds of medical benefits, because of the human endocannabinoid system.
Let's go back to the myths and the realities. The holy grail, as I've spoken to the doctor side of the medical side of it, is, and many people will disagree, of course, because there's many disagreements in the industry, is to relate phytocannabinoids as a curative, in a curative nature, as they relate to defects in our endocannabinoid system. Now, for those, I've just learned these things over the last several months, but your endocannabinoid system is really your homeostasis in your body. That's the old biology word, right? So the question is, in the Holy Grail, if we could prove someday, and we'll talk about it in a second, phytocannabinoids actually complement, if not cure, the defects in the endocannabinoid system, would that not be sort of a holy grail for the marijuana industry?
Yeah, but this is really, there's a concept of endocannabinoid deficiency, and it's not generally accepted, but that's exactly what you're talking about, which is the concept that some of the problems that humans have, diseases, disorders, medical conditions, could be the result, I use the word could, no science here, early stage, could be the result of a endocannabinoid deficiency. Theoretically, those can be eventually addressed by cannabinoids from the cannabis plant. So yes, but it's early stage.
Okay, so let's go to the myths again. I've heard that there's over 20,000 cases of the benefits of CBD in medical circumstances, whether in this country or otherwise. Let's talk about the myths versus the realities from your perspective, Jeff, in terms of medicinal marijuana. What does it do and what doesn't it do, and what are the myths and realities? Please.
Well, the first answer to that is I'm not sure, because the science isn't there. You have to come back to the science. But there's so much, there's so much information. We all know of people that have benefited, whether it's older patients with marijuana, or someone going through chemotherapy, or someone having AIDS, or someone having had rotator cuff surgery that benefits from marijuana, to dismiss it all. I mean, the DEA dismisses it all. The FDA doesn't want to hear about it, but there's just too much evidence going back 5,000 years. So what is the bottom line of this? And the bottom line is that, we talked earlier today, it was mentioned about cannabinoids that, because they're chemical compounds, that are actually produced in a laboratory. They can be produced. CBD can be produced and is produced in laboratory conditions as a chemical compound. THC, the psychoactive, can also be produced. Those don't work so well. The US government held the patent on synthetic THC, which they sold to a private company that was developed in Israel. And they don't work so well. So the real answer has to do with the other cannabinoids everybody believes, and what the interaction is at the cellular level. In other words, in the human body, it could be mostly about THC, the psychoactive, it could be mostly about CBD. Provides anti-inflammatory and other benefits, but in order to really make those work, something else is going on at the cellular level. It's been called the entourage effect, named by Israelis again, but we're not sure what that exactly is, or why it works, or how it works, or what that other cellular interaction is, because quite honestly, research in the United States has been illegal. So the bottom line today is that THC, which you can get from smoking the plant or vaping it, or pills, etc., has a lot of benefits for medical use, for pain, for patients going through chemotherapy or AIDS. And what happened was Sanjay Gupta on CNN, and maybe a lot of you saw his initial show, Weed, which was a couple years ago, and he was very much against marijuana, medical marijuana, or any marijuana. He became a believer. And he became a believer over this little girl, Charlotte Fiji in Colorado, who she had Dravet syndrome. She had a couple hundred seizures a day, form of epilepsy. She used a product that was eventually named after her called Charlotte's Web. And it reduced her seizures from 200-300 a day to a couple a month. That was a product that was essentially all CBD with just trace amounts of THC, CBD being non-psychoactive. And she took it in the form of a tincture under her tongue. So that was sort of a mind changer for Sanjay Gupta. And it brought sort of the marijuana legalization discussion to Main Street and to a lot of states that wouldn't have considered it.
You know, you said that research with medical marijuana has real legal problems in the U.S. You talked to me and others about Israel being a prominent place for research. Tell us about outside the United States, where is medical marijuana developing? And I really like to know, what stage of development are we at? Are we infant, adolescent, adult? Where are we? Like, where is it extra border, outside, and what's the status, please?
I think it's pre-infant, just to be safe, you know. But the research that's gone on the synthetic, there is some research here. There's, like, you know, you pull it up, and about a third of my book talks about the status of research. And when you read it, it's like, this isn't real science. You know, this is, somebody did a research study on rats, somebody did something on, you know, something else, somebody thinks this. San Francisco allowed it for AIDS patients, so it's very early stage. There is now, one of the problems with research in the United States is that marijuana itself has to come from the official U.S. government source run by the University of Mississippi. And it's sort of marginal marijuana. In order to obtain it, you had to get approval from the DEA and other government agencies. Very bureaucratic and not good marijuana. I would say right now that my opinion is probably 90% of the real medical marijuana research in the world is still being done in Israel. A little bit in the UK. We all know about GW Pharma, which obviously has the first clinical trials under FDA in the US. And it's starting to be a little bit in the US, but it's still a problem. A lot of universities don't want to touch it because the plant is still Schedule I Plant and the Controlled Substances Act. So it's not really easy for researchers to do research here still.
Early stage, we know that early stage technologies, whatever field, run into these little junctures. Hopefully good news keeps supplementing it and nourishing it and enhancing it. What about the bad news out there? What about the abuse out there? What have you heard in terms of other countries' research, particularly in medical marijuana, but where are the negatives in terms of the developments in the industry with respect to technical matters?
Well, I think the negatives, the one problem, you know, people talk today about edible products. We all hear about them, you know, going back to the 1950s with the L-spitoclus brownies, and brownies are now made from extracts. The problem is, I think edibles are a problem. We're running out of time here. Edibles are really a problem because if something looks like a Hershey bar or a cupcake, there's a high probability that a kid's going to get a hold of it. And that's really, it's proven to be a problem in Colorado. It's going to continue to be a problem. That's really an issue. But the big issue is that people making medicine in the United States, and I don't care if it's the 24 states or so that have medical, predominantly Colorado, California being the biggest one, you have people that are making medicine who were druggies, who were criminals, whether they got caught or not, who didn't graduate high school. They're making medicine. We don't know what we're buying. We can read on the label what it says, but we don't know what it is. We don't know if there's quality control. And I tell the story, if I have a headache and I go into Walgreens and I buy ibuprofen and it helps my headache, and I go back in 2 weeks, I have the same headache, and I go into Walgreens again to buy more ibuprofen, I expect the same results. And you have no guarantee with, you go into the same marijuana store, whether it's a dispensary or whatever, you buy the same product, no clue whether you're going to have the same experience from it, whether it's on the recreational side, Kevin, or quite honestly on the medical side.
Jeff, I have to conclude, and I could listen to you for hours, and I really appreciate all the things that you're doing to separate the myths from the realities. I urge everybody to read his book. I just got it myself, and I thank you very much, Jeff, for all you do for medical marijuana.